Welcome to our channel, Medicine World TV. In this episode, we will discuss on anti-ulcerant and uterotonic agent misoprostol. Therapeutic class, Prostaglandin E1 Analog. Let's start. Keep watching. Misoprostol is prescribed for the following purposes: providing preventive measures against gastric and duodenal ulcer in individuals using NSAIDs who are at an elevated risk of complications from gastric ulcer. Promoting the recovery of existing gastric and duodenal damage caused by NSAID use. Facilitating the healing of gastric and duodenal ulcer in cases where NSAID therapy is not involved. Initiating the process of labor. Safeguarding against and managing postpartum hemorrhage. Now we will discuss about anti-ulcerant effective misoprostol. Misoprostol is a synthetic prostaglandin E1 analog. It directly stimulates on prostaglandin E1 receptors on parietal cells in the stomach, then misoprostol induced mucus and bicarbonate secretion, as well edema of the mucosa is occurred, which causes thickening of the mucosal bilayer. It ultimately results in a reduced backflow of hydrogen ions and improved regulation of mucosal blood flow. This activity leads to the preservation of the mucosa's ability to produce new cells. Thus, misoprostol inhibits basal and nocturnal gastric acid secretion through secondary stimulation from food, alcohol, NSAIDs, histamine, caffeine, etc. Now we will discuss about how misoprostol shows uterotonic effect. Prostaglandin binds to smooth muscle cells in the uterine lining, inhibits of adenyl cyclase, resulting reduction of cyclic AMP from ATP. It increases intracellular calcium influx. Ultimately, uterotonic effect occurs, that is, uterine contraction, promote labor and cervical ripening, and help to decrease postpartum bleeding. For benign gastric and duodenal ulcer, as well as NSAID-associated ulcer, take 800 microgram daily, split into 2 to 4 doses, with meals, and at bedtime. Continue treatment for a minimum of 4 weeks, and extend up to 8 weeks, if necessary. As prophylaxis for NSAID-induced gastric and duodenal ulcers, take 200 microgram, 2 to 4 times daily, along with NSAID medication. If this dosage is not well tolerated, a dose of 100 microgram can be used. For labor induction, insert 25 microgram into the posterior fornix of the vagina. Repeat every 6 hours, if needed, up to a maximum of 200 microgram total misoprostol. Alternatively, take 100 micrograms orally. If cervical ripening or active labor does not occur, administer 100 to 200 microgram of oral misoprostol every 4 hours until labor is established. The maximum number of doses is 6. Keep track of maternal vital signs, fetal heart rate, and contractions. Oxytocin can be initiated 4 hours after the last dose of misoprostol. To prevent postpartum hemorrhage, take 600 microgram orally, right after delivery. For the treatment of postpartum hemorrhage, take 600 microgram orally, or 1000 microgram rectally. Generally, misoprostol is well tolerated. The most frequent adverse effects associated with misoprostol therapy involve the GI tract, such as diarrhea, abdominal pain, dyspepsia, flatulence, nausea, vomiting, rashes and dizziness. The incidence of diarrhea may be minimized by administering the drug after meal, and at bedtime, and by avoiding concomitant administration with a magnesium-containing, or other laxative antacid. Due to the abortifacient properties of the misoprostol component, its use is not advised for pregnant women. It should only be considered for women of childbearing age. If the patient necessitates nonsteroidal anti-inflammatory drug, NSAID, treatment, and is at an elevated risk of developing gastric or duodenal ulcers, or facing complications from such ulcers associated with NSAID use, in such cases, it may be prescribed. If the patient meets the following criteria: has recently undergone a negative serum pregnancy test within 2 weeks before initiating therapy, demonstrates the capacity to adhere to effective contraceptive measures, has been provided with both oral and written cautions about the potential risks of misoprostol, including the chance of contraceptive failure, as well as the potential harm to other women of childbearing potential if the drug is taken accidentally, intends to commence treatment only on the second or third day of the subsequent regular menstrual cycle. While there is a possibility of the active metabolite, misoprostol acid, being excreted into breast milk, this has not been extensively studied due to the potential for serious adverse reactions in nursing infants. The use of misoprostol is not recommended for breastfeeding mothers. Misoprostol is contraindicated to anyone with a history of allergy to prostaglandins, and it is also contraindicated in pregnancy. For the prevention and treatment of NSAID-induced gastric and duodenal ulcers, misoprostol should not be administered to pregnant women, and it should be avoided in women who could potentially become pregnant unless NSAID therapy is deemed necessary. Women in their childbearing years must understand that they should not be pregnant when initiating misoprostol therapy, and must use an effective form of contraception while using the medication. For induction of labor to be considered, the pregnancy should have reached at least 38 weeks of gestation, according to reliable dating, or there should be clear evidence of lung maturity, indicated by a L/S ratio greater than 2.0, or a positive phosphatidylglycerol test. Alternatively, if there is a maternal or fetal medical need, labor induction may be considered after 36 weeks of gestation. However, labor induction is not recommended in cases of acute fetal distress, abruptio placenta, placenta previa, or unexplained vaginal bleeding. Additionally, the fetus should be in the vertex presentation. Bangladeshi brand. Cytomus, tablet 200 microgram, Incepta Pharma, Isovent, tablet 200 microgram Square Pharma, Isovent, tablet 600 microgram Square Pharma, Cytomus, tablet 100 microgram Incepta Pharma, Misoprostol tablet 200 microgram Ziska Pharma, Cytomus, tablet 600 microgram Incepta Pharma, Indula tablet 200 microgram, Renata Limited, Miptol, tablet 200 microgram Acme Laboratories. Innovator brand, Cytotech, Pfizer, Germany. If you like this video, please subscribe our channel, Medicine World TV, and push the bell icon for getting more video regarding medicine. Thanks for watching. Stay with us.